beyond keeping our intimate bits intact, there is also the lifting of the whole body that comes with this treatment. So I don't just look at EMSELLA, which is the Emsculpt NEO equivalent for the pelvic floor. I don't just look at it as a pelvic floor maintenance. I actually think of it as an absolute necessity for both men and women to have on a day-to-day basis.
Well, the idea behind EMSELLA when it was developed and it was launched in 2017 is that number one indication for EMSELLA is incontinence. And one underlying issue of incontinence is actually loosened muscle, loss of muscle tone in the pelvic floor muscles area. And how we are helping the patients is with a pretty much similar mechanism with the Emsculpt NEO. So thanks to these supramaximal contractions, we are actually rebuilding, re-educating the muscle in pelvic floor muscles, and thus helping substantially, dramatically people with their incontinence. And also, as you said, it's not only ladies patients who suffer from it, but also male patients as well. It works brilliant, it works really great. With combination of both Emsculpt NEO and EMSELLA, we actually have, let's say, how to call it. We came up with our new protocol. It's called core to floor therapy, and you can really benefit, or patients are benefiting on a daily basis, I'm very happy to say, from combination of both in terms not only about building their muscles, the core muscles, but pelvic floor muscles as well. Much substantial improvement of the incontinence, as well as the balance, the core strength, and everything that comes with it.
I think it's also a treatment that gives you a lot of confidence back in your body. I know this was the first treatment that I had after having a baby, and I think your body can go through so much as a woman and a man, I'm sure in different ways, but I think it's really valuable to sort of sit on this chair, and as we know, you can be fully clothed, it's really relatively comfortable. You know, a course of very quick sort of painless treatments, but really feel like you are getting that confidence back in your body again.
Absolutely, Francesca. When I first brought EMSELLA pelvic floor chair into my clinic, it was 2 Decembers ago. And for those of you who have been to the clinic, you would actually see it was outside of my room. And the reason I put my technologies there is just so that I can get to it quickly without needing to go upstairs. So I buy all of my treatments and technologies for me. I've not had children yet, but we all still experience symptoms, even through natural aging. So what better way than to be fully clothed in my scrubs or my suit, jump on the chair, get my work done whilst having a treatment with 0 downtime. And then I can do that 2 treatments once a week, 3 times. So I'm done in 3 weeks without feeling a thing apart from really, really energized. And then I get my maintenance treatments for myself every 3 months. And that way I'm just keeping my supramaximal contraction, my tone. I'm not worried about things in my life. And after 1 year of doing that, I took my chair and I put it upstairs in privacy because I was happy with my result and I'd reached my personal level of satisfaction for me.
And what's the feedback you're getting from patients?
Fantastic. So we're seeing almost a 70% improvement in genuine stress incontinence in just after 4 sessions. And that's after 4 out of 6. So in as little as 2 weeks.
That's incredible. And in men, how does it sort of benefit men?
The feedback, you like the word I used yesterday, they feel
It's an
less
interesting one to
saggy.
mention though, because it's obviously not a device just for women.
No, but I think the older gentlemen get it. They just do. And we've had, especially the European older gentlemen, they're a lot more vocal in their feedback. And they completely get it because I think the Europeans speak about these things a lot more than the British gentlemen. And I apologize to the British gentlemen, but it's true. We're a lot more conservative in this country and we're a little bit more private about these sort of things. And so I think there has to be an etiquette and a decorum how we integrate these technologies through our clinics and who we approach so that people can get access to them comfortably in their own time.